Professor Alex van den Heever says that South Africa's COVID-19 pandemic trajectory is far from clear. While the lockdown initially impacted on the trajectory, on Friday, South Africa recorded 663. These were the biggest single-day increases reported since the start of the COVID-19 outbreak in the country. Now, to discuss this further, we're joined via Skype by Professor Alex van den Heever, the chair in the field of Social Security Systems, Administrations and Management Studies at the University of the Witwatersrand School of Governance. A warm welcome to you, Prof. Thank you so very much for joining us here on SA Today.
Good afternoon.
As a start, you've said that we've not actually flattened the curve, as you can see from the stats, and that our current trajectory is very concerning. Talk to us, please, about your findings.
Well, part of the reason for the introduction of the lockdown was to buy time to implement additional public health intervention programs, such as substantially upscaled testing and contact tracing. And these approaches should have been in place quite a while ago. And they are really the only strategy that we would have going forward to manage the epidemic within the South African context. So what we are seeing now is an increase in new infections in South Africa that should have been prevented by the measures that we'd introduced over the past month and a bit. And so it's worrying that we're now seeing increases where we should have seen decreases. And it means that part of our prevention strategy has essentially failed.
You know, you mentioned the word fail, but listening to the WHO briefings this week, there was one focusing particularly on Africa, and Dr. Stephen Karinga from the WHO had said that we must be thankful of African governments who have done a lot to make sure that we are not where it had been predicted that Africa would be. Do you not agree with this? I mean, what more could have been done by African governments when people that are part of the WHO are saying actually they've done well?
So I can't speak for other African countries, but speaking for South Africa, what we should be doing with an intervention is essentially suppressing the epidemic. That what we should have done with our interventions, because we intervened relatively early, is that we should have turned the epidemic down and reduced the new infections. So other countries that had intervened early in other, certainly on other continents, have effectively prevented the epidemic from spreading. So we might have curtailed one part of the epidemic, which was really that part which impacted on the sort of relatively affluent communities who had introduced the epidemic to South Africa. But the problem is that the lockdown as a prevention strategy has not really terminated or suppressed the epidemic. And that is our sort of fundamental problem, is that our intervention strategy is not appropriate for the South African context. We need to be able to suppress the epidemic in densely populated urban communities, and we are not really ready for that. And that is a concern. So now we're seeing the new infections that really should have been prevented by the level of the scale of intervention we've had so far. And a lockdown is a very expensive strategy from an economic perspective. And what you can't do is introduce it and have it fail.
Yeah. You mentioned the fact that, we've introduced this lockdown strategy and that it's basically failing. What other prevention strategies could we use at this time? I mean, you said that we didn't intervene early enough. What other measures could there possibly be at this time, apart from lockdown, social distancing and so forth? And also at the back of that, we've got people who are saying actually they want to go back to normal. And would you advise that this is the right time to do so? Because we've got people saying that this isn't working for them, they'd really would like to go back to normal, and that they don't want to carry on with lockdown and social distancing. So would you at this point then say no? And on the top of that, would you say there's other prevention strategies that we should actually be using at this time?
Yeah, so it's a question as to which strategy has to be our key one for suppressing the epidemic. the lockdown as a measure itself is not going to succeed within the South African context. So you have to look at alternative measures. This isn't really withdrawing. It's not about withdrawing public health interventions. It's about introducing public health interventions that will work within this context. And it was very, very clear from early on in South Africa that the lockdown is not going to be successful in our densely populated urban communities. So we would have had to introduce smarter, more targeted strategies, which would essentially separate the infected from the uninfected through scaling up testing and very rapid testing and contact tracing within the densely populated communities. That means you're interrupting the epidemic wherever it starts to emerge as quickly as possible. But that means you have to scale up testing and tracing. The social distancing strategies are okay. That's not a full lockdown, and we need to maintain them, as well as basic screening, as well as making sure that people, for instance, wear masks, that we've got to be careful about how people are protected in public transport, at the workplace. Those things should remain. But our public health strategy has to be compatible with keeping the economy open, but it also has to be one that works for the way in which our society is constructed. So we haven't basically invested in the platforms that would give us our key strategy, which is testing and tracing at scale.
Yeah.
And rapidly.
Yeah. And this is the reality of South Africa, though. The fact is that, you talk about the densely populated areas, and, we, as the SABC, have gone to some of these areas. As an example, we've gone to Alexandra Township, and the reality of the matter is that it is difficult to really bring in those strategies that you're talking about. I mean, it's one thing if you're talking about the suburbs where, you have houses that are sort of separated from each other and you can actually see what's going on. But if you take a look at a place like Alexandra, if you're talking about these smarter and more targeted strategies, how exactly would they be implemented in those areas where you literally have people living on top of each other, Prof?
It means that you'd have to be able to identify people who are positive within those environments relatively quickly. So there are the options of sample testing. So some of these strategies might be off the table now because we didn't build up the capability when we had the time. But what you would be doing is doing some sample testing, some sentinel surveys, and you would then be identifying where there are potential outbreak clusters and then targeting those areas with an intensive intervention. So it's very much about a continuous process of putting out the brush fires. That is really our only game plan. We don't have alternatives to that. The only alternative to that is to have the epidemic escalate out of control. And so the blunt instrument of the lockdown is not going to work. So our only alternative has always been testing and tracing at scale.
Yeah.
And there are different ways of implementing smart testing and tracing. But those are the discussions that we should have had. But now it's a question as to whether or not we can implement any equivalent strategy to that within the remaining month, that we are going to see an escalating epidemic. And the problem is that if the new infection levels get too high, then contact testing and contact tracing cease to be an available strategy.
Yeah.
At that point, you either let the epidemic run wild or you introduce a whole series of potentially targeted lockdowns in areas where you have no idea what's going on. And I think that would not be an advisable strategy. It would be better for us to be in control and ahead of the epidemic rather than behind it. And I fear now that we're moving to a point where we are going to be behind it.
Yeah. And just in closing, you've made a correction in your article that I just read, mentioning the fact that, the Western Cape has erroneously been described as the epicenter, perhaps for the sake of our viewers at all that have been referring to the Western Cape as the epicenter of the virus in South Africa. You can go into explaining why, in fact, we shouldn't be referring to the Western Cape as the epicenter of the virus in our country.
Yeah, an epicenter is a central point at which an epidemic is spreading. It's not the area where you're detecting the largest number of new infections. So it's completely inappropriate to refer to it as an epicenter. It would be appropriate to refer to New York as an epicenter of quite a large outbreak within the United States context. But there were also epicenters within the West Coast, where people had traveled recently from Asia. But the people who had traveled from Europe came into New York, and the infections began there, and that was an epicenter for the spread. But you don't identify an epicenter just on the basis that it's where you're detecting the largest number of new infections. And within the South African context, we are not totally certain where all of our infections are, because we're not necessarily testing efficiently throughout all of South Africa.
All right, Prof. Alex van den Heever, thank you very much for that. We do appreciate your time. Keep well.
Thank you.